Which of the following structures is the site of gas exchange in the lung? A. The bronchiole. B. The bronchus. C. The alveolus. D. The pleura. The answer is C. The alveolus. Gas exchange in the lung occurs exclusively in the alveoli, the tiny grape-like clusters of sacs at the terminus of the bronchioles of the lung. The gas contained in the larger structures of the lung, the trachea, bronchi, and bronchioles, is termed dead space as it does not participate in gas exchange. Which of the following is the main trigger for the impulse to breathe? A. Low blood oxygen. B. Constriction of the bronchioles. C. High blood carbon dioxide. D. Dilation of the bronchioles. The answer is C. High blood carbon dioxide. The main trigger for the impulse to breathe is high carbon dioxide, decreased blood pH. In response to a decrease in blood pH, the medullary respiratory center triggers the diaphragm and the external intercostal muscles to increase breathing rate. Myoglobin combined with dash molecules of oxygen, while hemoglobin combined with dash molecules of oxygen. A. 3. 4. B. 1. 2. C. 2. 4. D. 1. 4. The answer is D. 1. 4. Myoglobin, an oxygen-binding protein in the muscle tissue, combined with one molecule of oxygen. Hemoglobin, the main oxygen-binding metalloprotein in red blood cells, combined 4 molecules of oxygen. Hyperventilation results in which of the following? A. Ketoacidosis. B. Respiratory alkalosis. C. Metabolic acidosis. D. Respiratory acidosis. The answer is B. Respiratory alkalosis. While hyperventilation or tachypnea may be triggered by various forms of acidosis, they will not cause a decrease in blood pH, but rather push the blood into a more alkaline state. This occurs due to loss of carbon dioxide during respiration, followed by a compensatory decrease in bicarbonate ions. The result is in an elevation in the pH of the blood. This condition is known as respiratory alkalosis. What does the term partial pressure describe? A. The pressure contributed by a single gas in a gas mixture. B. The pressure of an overall gas mixture during transition, adding a new gas. C. The pressure of a gas at 1000 meter above sea level. D. The difference between the gas pressure at a particular altitude and sea level. The answer is A. The pressure contributed by a single gas in a gas mixture. Many gases, such as room air, are composed of several gases, in the case of room air, primarily nitrogen, oxygen, and several trace gases. Partial pressure is the amount of pressure that each gas contributes. To find the total pressure of a gas mixture, one would find the sum of all partial pressures of each individual gas. How do oxygen and carbon dioxide cross the capillary epithelium and alveolar cell membranes during gas exchange? A. O2 transporter. B. Osmotic exchange. C. Simple diffusion. D. CO2/O2 pump. The answer is C. Simple diffusion. Gas exchange in the alveoli occurs by the process of simple diffusion. The blood that enters the lung capillaries is relatively low in oxygen and high in CO2, in comparison to the room air that is drawn into the alveoli during respiration. The separation between the capillaries and the alveolar epithelium is thin enough that these gases can exchange across their pressure gradients by the process of simple diffusion. Increased epinephrine would have what effect on stroke volume? A. Stroke volume would stay the same. B. It would cause irregularities in stroke volume. C. Stroke volume would decrease. D. Stroke volume would increase. The answer is D. Stroke volume would increase. Increased epinephrine, released either by the adrenal medulla or by myocardial innervation, increases contractility in the heart, which in turn increases stroke volume. Which of the following valves must blood pass through to go from the right atrium into the right ventricle? A. The tricuspid valve. B. The semilunar valve. C. The foramen oval. D. The mitral valve. The answer is A. The tricuspid valve. Blood in the right atrium must pass through the tricuspid valve to enter the right ventricle. The mitral valve is between the left atrium and the left ventricle. The semilunar valves are located at the base of the aorta and the pulmonary trunk, also known as the aortic valve and pulmonary valve. The foramen oval is a type of shunt that exists in the fetal heart. Its presence in an adult patient is a form of congenital heart defect. The S2 heart sound, dub, is heard during what part of the cardiac cycle? A. Diastole, during the closing of the aortic and pulmonary valves. B. Systole, during the closing of the aortic and pulmonary valves. C. Diastole, during the closing of the tricuspid and mitral valves. D. Systole, during the closing of the tricuspid and mitral valves. The answer is A. Diastole, during the closing of the aortic and pulmonary valves. The S2 heart sound, sometimes referred to as the dub-in-lub dub, occurs in diastole, during the closing of the aortic and pulmonary valves. When pressure within the aorta and pulmonary arteries exceeds pressure within the heart, the cups of the valves fill with blood and snap shut, causing the dub sound. Depolarization is able to travel in a uniform wave through myocardium due to what physiological feature? A. Gap junctions. B. T-tubules. C. Striation. D. Desmosums. The answer is A. Gap junctions. Depolarization is able to travel in a uniform wave through myocardium due to the presence of gap junctions. These junctions allow the depolarizing current to be transmitted directly from cell to cell in the heart. Striation in cardiac muscle is a feature of contraction, created by overlapping thick and thin contractile filaments. Desmosomes are strong fiber-like anchors between myocardial cells and T-tubules, while an important part of depolarization, are not responsible for the rapid intercellular communication that occurs as a result of the presence of gap junctions.